away from our conversation. I think our conversation, we kind of discussed how, for me, I live in a small town, which can have some real, pros, but some challenges as well. There are things that I love about being in my current community with having small kids, that it feels safe, quieter. I have real relationship with neighbors and people in our community, but I also think that some of those things that can provide some sense of safety can also come with the cost in a small community where there's kind of a lack of diversity. And so I think that that can be a real challenge, especially with working in social services and in a community like mine that has some difficult cultural tones and political things and stuff like that. So I think there's kind of pros and cons to being in a smaller community while trying to engage a marginalized population. That was kind of my takeaway.
Absolutely. And thank you so much, Kayla, for sharing. Yes, in most instances, we think of what speaks to our sense of safety, our sense of homogeneity, as well as we want to have a sense of a kind of a diverse community, diverse perspective. But, it's like anything else. In order to gain something, sometimes you have to give up something, right? There's a balance. But it speaks to how we view our own connection to that community, how that community impacts our lives. But that's certainly a great sharing. Jessica, go right ahead.
Hi there. Pamela and I talked, and we both were surrounded by neighbors that we felt were looking out for us or our kids. They were paying attention, and when I had questions, I could talk to them. We were surrounded by people that are older than us and wiser than us and are there, and that's great. I think some of the things that we could change are like bigger systems things, like how expensive it is to rent in the neighborhood. So, and then also where I live, you could probably see this map behind me. I live in a part of an Indian reservation where one part doesn't connect with the other. And these are like bigger systems issues that need to be addressed over time. So like rent issues need to be addressed over time, connecting with people and land issues, another big thing. But on a day-to-day basis, we feel connected to the people that are around us.
And that's fantastic. Thank you, Jessica. Certainly, it comes with the one thing we learn is that the ideal environment or the neighborhood is ideal because it speaks to what's significant, what impacts our quality of life. But at the same time, we know, ideal doesn't mean it meets everybody's needs in the same way, right? But in part and parcel, it's about really assessing what you have in comparison to what maybe, in some way, not necessarily fulfilling our stuff. So there's a balance. Sometimes you have to look at, more than anything else, the good things or the positive things that they outweigh some of the shortcomings or the things that you prefer to have. Because as we know, there's no perfect place to live, right? It's how perfectly we live within that space. Christina speaks that I would want to find a way to get the gang rate down and give the youth something that could help them know their value. I hear you. I can certainly appreciate that. And it's about really, think of it. It's so much about what attracts people to gangs. Oftentimes it's that sense of belonging, that sense of having that community, ideally and ironically in that sense, right? A sense of family, sense of community, a sense of someone to look out for you, someone's looking you look out for. So it's in more ways than not the same kind of qualities and principles that we speak to in a general society sometimes attract people to outlier elements of that society. But I appreciate certainly a great deal of feedback and what that means. But what was most important about this exercise is to see yourself, look in the mirror and see how you would respond to those questions so that when you're asking those questions of the people you serve, you have a sense as to how it may be impacting them. how deep they may be digging in their psyche to come up with those answers that you think should just be at the tip of their tongue. Does that make sense? I want you to have an empathetic perspective, because sometimes we don't know what it feels like to be asked a question that comes so naturally to us as part of our job. But remember, you are speaking to another human being, another person that has their own experience, their own sense of who they are and how the society that they live in, the community they live in, may be impacting their lives. So I hope that was a meaningful exercise in that concept particularly.
Can I add to that?
Absolutely.
One thing that someone in our group had brought up, and they had pointed out, they came from a smaller town, and so the resources in that town were much less than where they are now. And it was also interesting because she followed up with, but with how big the area is that we live in now, we're still lacking the resources to support a big chunk of the community. And it is so true. I think services everywhere are lacking, and there's a lack of resources and things like that. And specifically, like where I work, we have a DOC contract, and we also contract with the city and are in our service providers inside of a big shelter here in Spokane. And seeing the need for just the variety of services and also the lack of availability, while also probably having much more access to certain things, kind of balancing that with like what their goals are and where they have to start with that. Because even though there are services, getting to those services or having access to it, because there's only, the need is so high and the availability for people to get access to it is so low because it gets utilized so quickly.
I understand that. I mean, I think, Amy, you're speaking to, probably that's the most consistent thing we've heard. And it's not simply relegated to Washington. I think most cities, there's a concept, because the government looks at it oftentimes in that way when, you hear, well, there's a great deal of service to this community, but accessibility and not only the ability to access it, but are the services intended for specific populations getting to those people, right? And are we able to facilitate access and maximization of those resources? And are some of those resources really dedicated to the people who can benefit the most from it? So there's lots of caveats, there's lots of variables, but it's that concept of, I love the small town feel, but I want the big city resources. You ever heard of that?
Yeah.
Absolutely. I think we're all in that vein, but it's just important for us to have that concept when we step into an arena with a consumer we're serving and we're talking about services and why they're not following their treatment plan and why they're not accessing services. We have to have a awareness and understanding that it's a lot more complicated and sometimes complex than we make it sound, or we can project it. Because sometimes it being present in the community don't mean it's accessible to the people who need it the most.
Yeah. Yep. And also in comparison to the need too, that's a huge part of it. The need is so great. And we, if I'm just looking at the shelter that I primarily work out of, the need is so great, and we have tons of resources. We have DSHS in there. We have housing and employment services. We have other housing and employment services that come over so that there's, additional resources. We have people, cell phone services that come in for the free government phones. We have Chaz, we have a walk-in psychiatrist. I mean, there's a ton of resources there, but it does not even begin to tap into the need just there alone, let alone the overall need in the community.
Yeah. And I'm sure, there's a number of people who may be hearing you lay out all this resources you have and said, oh my goodness, I wish I had half of that, right? So, but
yeah, absolutely.
At the same time, in your community is not meeting the intended purpose in that it has the quantity to do so, right? So there's always elements and variability to it. So I say that clearly because I want people to understand clearly when you tell someone, why haven't you done A, B, C, D? You have to think more than simply that person's, you have to be able to look beyond that presumption that is just that person is either lazy or unmotivated. There may be lots of layers beyond simply going out and accessing that service. It's a lot more than that when it comes to people not being able to meet their needs. There's lots of other elements to it. So we can spend all day on that, but I'm glad that we kind of tap into that and get your feedback. So I have a concept as to how things are in Washington State in specific areas. But I appreciate it. So I want to take a look at psych rehab values, because a lot of what we do and how we do it is driven by those values. We know the goals of psych rehab: community integration, recovery, and quality of life. But those aspiring and pursuing those goals are actually driven by operating and providing services in a way that is actually aligned with certain values. And for psych rehab, there are values that are very specific: self-determination and empowerment. And we just spoke to that in terms of people having that ability and opportunity to actually determine how they want to live, where they want to live, how they access service, what service they want to access. So self-determination and empowerment is a major value, a significant value of psych rehab, as well as optimism and that everyone has the capacity to recover, learn, and grow. Cultural diversity, dignity in the worth of every individual, promotion of valued social roles and normalized environment. These are the prevailing sustainable values of psych rehab. These are the expected values you'll be bringing to your engagement with the folks you serve. And it's very difficult to actually authentically provide a service without you believing and ascribing to these values. It is very difficult to speak to someone's heart and soul and inspire them to pursue their maximum goal if you don't believe in self-determination and the ability to empower that person. So we talk about those fundamental values that are significant. And it means that you have to live it, reflect it, project it, and model it. And I know that's like asking a lot, but it's what's being asked of you in order to actually provide a service in an authentic way from a psych rehab perspective. Do you see any of these values in your work? In the way you work, does the way you work reflect these values? Great to hear it. And sometimes it's easy to forget why we do what we do and what's the inspiration, what's the motivation and the values behind it. So this gives us a roadmap. This really lays out a GPS for us to know where we're going with our concept and philosophies. So continue to think of whether or not your work and the way you work really reflects the values of psych rehab, because I'm sure for most of you it does. As you know, you don't come into this field to get rich and famous, right? You come into this field because you have an authentic, intrinsic desire to help people and to see them thrive and to believe in their capacity to grow and evolve into the best person that they can be. Yes, celebrate the wins. And there's the guiding principles of psychiatric rehabilitation, and I'm going to prompt you to really look carefully within the next week at the values and principles of psych rehab, because they really drive the mindsets and the principalities by which we operate in psychiatric rehabilitation and how foundational community support is best meets its need. So we talk about the person-centered approach. And I'm going to hazard or guess that most of you are familiar with the person-centered approach and most likely engaging in practices that really reflect the person-centered approach. Want to make sure that you're utilizing peer support. And I'll tell you this, the one thing I can say concretely about Washington State, you are a pace setter for peer support, utilization of peer support. We boast and brag about Washington State and your auspicious and profound utilization of peer support and how well you do it. You set a tremendous model for most other states. So take a bow. Washington State, you are ahead of the curve when it comes to peer support. Utilization of natural supports, people in that person's life, how they can best help that person so that they're not entirely reliant on professional supports for all their supports. So there's a lot of values and principles that are important for you to be aware of as you continue to provide the service you provide, to really have a sense as to how it aligns with psychiatric rehabilitation. And I'm sure you see most of those principles in your work. So the services in FCS are aligned with the values and principles of psychiatric rehabilitation. FCS is about collaborative work with the client from the goal identification to the service plan. You're really working side by side with that person. It's person-centered. It's beyond symptoms or illness or it's focused on goals. It's focused on aspirational elements of that person's life. How do they see themselves operating in the world in the best way possible? What goals do they have beyond simply ameliorating or mitigating symptoms? It's individualized. The services in FCS, whether supportive housing or supported employment, it's really individualized. It's targeted and specific based on the strengths and unmet needs of that person. So FCS services are really stem from a comprehensive assessment of that person's skills, the knowledge, skills, and resources they bring to the table. We utilize this as best as possible to ensure that we maximize those efforts and those strengths that the person brings in their pursuit of their goals, their quality of life, the community integration, and the recovery goals. And Jeremy Starr, FCS is foundational community supports. In many other states, like in the state of New Jersey, we call it community CSS, Community Support Services. Washington State has designated it FCS. But it's really comprehensive element in that it speaks to both housing and supported employment. So it's important to understand that FCS, the services embodied in FCS, is not just by happenstance or simply based on someone's ideas to what good practice is. It's based on the principles and the practice and the learned and research concept of psychiatric rehabilitation. So think of how you promote engagement and participation in the services. What are some of the things that you do to really inspire people to engage in the services? When you speak of a collaborative, person-centered, individualized approach, what is the primary way in which you engage people to ensure that you're aligned with those principles? Consistency. Yes, you have to show up when you say you're going to show up. You have to be there. Be a person of your word. You have to encourage. You have to do the outreach. You have to ensure that you have a good enough, trusting, relationship with that person that enables you to have a good understanding as to what their needs are as it relates to community integration, recovery, quality of life. What is important to them, says Kim? Absolutely. So the goals about that person's value in their own life as it relates to those areas of need. Cherry says you have to be genuine and build a genuine rapport with that person. Yes. Don't overpromise and underdeliver. The needs are established based on the assessment, and the service plan is driven by those needs being actualized into services. Voice and choice. Yes, you have to give empowerment and voice to that person so they can speak to their aspirations, their needs, what it means for them to live a quality life and to integrate successfully into the community. Angela says be an influencer, not an enforcer. I like that. Be a coach, a cheerleader. Be there. Meet that person where they are. Allow them to find internal inspiration and motivation to pursue their goals meaningfully and purposefully. Inspire hope. So we want to look at valued life roles and motivation quickly, because I know it may be, for us, it's quite common what it means, but I want to make sure that we're connected on that element. Think about the people and places or activities that bring you joy, strength, and meaning. So we want to talk about how you live, work, learn, socialize, other areas. Is anyone familiar with the concept of valued life roles? Have you heard that term before? Is that familiar to you? Rachel says no. Okay. I like that. Graham says, what is it? Yes, I'm holding out. I'm holding out. Valued life roles, and let me first give you a concept. Dr. Wolfingsberger, and it sounds kind of odd. I love the name. That's why I like to kind of project it out there. He really developed this theory of social role valorization. So basically, what he spoke to is he found that when people are not supported or have valued roles in the community, they can often find themselves, being seen or feeling as a burden or a menace or sick or dependent, or sometimes even considered subhuman or better off dead. And I think Gail spoke to someone who saw themselves in that light, didn't have value. And oftentimes people with disabilities and their families and friends and caregivers report daily instances of feeling segregated, excluded, marginalized, and ignored, or being treated as different. What valued life role speaks to is that person's perception of themselves in their best light, living to the fullest extent of their potential. So when we speak of valued life roles, we're talking about someone seeing themselves in a role that really speaks to joy and strength and meaning. A good example for most consumers is when you ask them what a valued life role means to you. And they ask you, well, what are you talking about? Give me an example of what that looks like. You can simply say a valued life role would be that of a good citizen or a parent or an employed person or a hopeful person. Today, in my role as a trainer, that's a valued life role for me. It has meaning. It has purpose. And that's so important, because if someone don't see value in their life and have a role, see themselves function in that role, it's very difficult to inspire them to pursue things beyond their current circumstance. And I like that, Kyra. That's exactly what it is. Living on purpose. And Alana speaks, I find meaning in my work and my business as I share what I learn with others. Those are valued life roles. Being a role model, being an effective case manager, being a thoughtful, empathetic manager, supervisor, leader, being a good student, a good mother, a father, a parent, a sibling, being a positive influence. So these are valued life roles that we speak to, because this is where we start our own concept of how do we help people formulate goals that are purposeful and meaningful for them. We speak to first what their valued life roles may be. Because when we have most of the consumers we serve who are already facing a lot of challenges, it is important for them to find that grounding source in remembering that they have value. And what role speaks most to that value that they can actually ascribe to, they can hold on to. That's where we start really that motivational connection with someone. Because as we know, regardless of where people are in their life, they came from somewhere. They had some sense of purpose before they are where they are, particularly people with persistent and severe mental illness. As you know, oftentimes people affected by schizophrenia may have had their first significant episode late teens, early 20s, may have been when they started college, may have been as they ended high school. So they were somebody, they still are somebody where they are currently, but they may have had a value. That person may have wanted to be a professional in some regard, or may have wanted to live on their own, live meaningfully, purposefully, have a role, have a connection. And it's important to kind of connect back with that. Dale Carnegie, and Sabrina says in Dale Carnegie, how to win friends and influence people. It's more about really helping that person find their own sense of purpose and meaning, despite what they're facing. Right? The homeless person on the street that you think and you say, hey, I see despite all the elements you're facing, you take a moment to say hi to people as they pass by. You still have a sense of value in this community, right? You make sure that you try your very best, even on your worst day, to potentially make someone else's day better by saying hi, good morning. Maybe simple and inconsequential, but it's significant. Because sometimes the hardest thing to do is to help people find meaning in their own life. And there's no magic wand, there's no magic word. Sometimes you just have to find it. You have to look for it. If you don't look for it, it's hard to find it. So what roles do you value? What is important to you? And some folks already spoke about being an influence, being a positive role model, sharing their knowledge with someone. Think of what roles are important to you in your work, in your role as a professional. And why do you value it? And what has it motivated you to do? Give me some examples. What is a role that you value? And why do you value it? Someone says being able to provide referrals, being supported to each individual needs that they are not alone, or they're not all the same. Empathy for others. Integrity is huge for me, says Jennifer. And Brittany says being a housing specialist and helping my clients to go from homelessness to housed. Empathy and love. Inspiring that person to believe that they will be housed, that they can be housed, and they can actually sustain. That's interesting. Stacey says providing self-esteem. That's interesting, because can you provide self-esteem? In essence, you can model it, right? Sometimes you have that sense that by osmosis, that person will pick up on it. You keep repeating, hey, I pride myself in doing this. What do you pride yourself on doing? Graham says homeowner because it means I'm invested in my community. It makes me want to be kinder to my neighbors. Jessica says, I really enjoy promoting courage and skills to connect to yourself and others. Christina says compassion and understanding. So we all bring that to the table every day with us. Yes, we know some days are more overwhelming and taxing for us that we forget sometimes that we are modeling those elements. But least you forget, you come into this with a concept as to who you are, how you want to be viewed, how you want to be responded to, and how you intend to make that happen. And by understanding that, you'll understand the people you serve also bring that to the table. And oftentimes they have to hide that because of their current circumstance. And it's important for you to shine a light on that and open the door and lay out a red carpet for them to feel that they can reacquire and revisit those elements of their lives. And think of it, the values that you have, your consumers have them, right? They want to be valued and seen as significant and important in our society. So during the next week, I want you to think of valued life roles and how they impact people's inspiration and motivation to actually work towards a better life, for a better circumstance for themselves. And because there's reasons why people may share or may not share valued life roles with you. In many cases, some people may be afraid, your consumers may be afraid that if they share their valued life role with you, you may not agree. And sometimes consciously or subconsciously, we can disagree without saying a word. Think of the homeless person who, is also challenged by substance use issues and tells you, I see myself being able to have my own apartment. And the first thought that comes to your head is, nowhere you're going to be able to do that without, first of all, attending to your addiction, taking your meds, you start going down the list of all the things that they need to do before they can even have that dream. But I want you to remember, being faced by challenges, even if they're acknowledged or not, does not necessarily evaporate someone's sense of who they want to be. So even though they may have, challenges or areas of deficit, inspiring that sense that you can still hold on to and be driven by your purpose and your value is just as important as doing every single activity that's related to recovery, doing the right thing, so to speak. Does that make sense? It is very difficult to help someone aspire for greater things if they don't see themselves as having value and purpose. So more often than not, we see people failing to engage effectively because it doesn't start with speaking to the person, connecting with that person's sense of who they are, how they see themselves in the world, and how they see you supporting them in reaching that level of value and purpose and engagement that they seek for themselves. That's the message I want to get across profoundly today. So valued life roles motivate change, which drives the FCS goals. And that's why I've spent so much time on that. They drive and prioritize goals, identify the assessment to make challenges and changes with staff support. If people don't believe in who they are and the purpose they have, it's very difficult for them to even look at a goal or prioritize a goal or engage in any change activity. Change starts with that person having a belief that they're capable, competent, and able to move towards a different state. And remember, not everyone is equally motivated, and every goal and motivation needs to be assessed. So people may be at different places with different goals and purpose in their lives. So I know we spoke a lot today about philosophy and values and principles and motivation behind FCS services. We spoke specifically about what the Golden Thread really speaks to in terms of that evidence, that evidence of what you provided and how it impacted that person's life, and the purpose for it being that's the way to meet the regulatory standards for Medicaid. It's the way to be reimbursed, and it's the way to demonstrate that you've provided quality services, and there's evidence of how that services have impacted that person's life. So as I spoke to earlier, this is a 6-session series. We started out today by looking at the introductory element of FCS and the Golden Thread. Next week, Monday, we'll follow with the assessment process and prioritizing areas of need. So we move from what motivates people, why the service is the way it is, what's the philosophy behind the service, to how do we assess that person's need and prioritize areas of need for service provisions. So the learning application, and we always give you a bit of homework. Don't be mad about it. It's just for you to ensure that you're reminded that unless you put things into practice, it's very difficult to see how effective it is for you in your day-to-day. So we want you to have a conversation with your client about valued life roles and learn more about them, right? Really engage with your clients about valued life roles and bring back that feedback to next week. I want you to take a minute or two, and I know we're just up on time, and to provide some feedback to us and an evaluation to give us a sense as to how did you see today's presentation, today's training. What is it that we can do differently? What can we continue to do the way we do to make sure that the training meets your needs and really speaks to you in your specific area? So if you take a minute or two and just provide some feedback for us in the evaluation, and Crystal put the evaluation in the chat. So while you're doing that, I certainly want to ask if you have any questions. This is the time to shoot questions. We'll be here for a few minutes. So, oh, Evelyn asked for the homework. I'll go back to the homework. So it's really have a conversation with a client about their valued life roles to learn more about them. And after discussing that valued life role, think about what you've learned and what was challenging with that engagement with the consumer. Go ahead, Jamie.
Hello. So it used to be that with, you know, the Golden Thread, they want to make sure that all services meet medical necessity. But what I'm hearing today is that it sounds like medical necessity has expanded a little bit. We used to struggle with keeping people in services because, let's say, they were no longer dealing with severe depression and maybe ostensibly didn't have depression anymore, but then they were still working on things. They weren't satisfied. They had life goals, but we would have to discharge them. Has there been a change as to, like, what does medical necessity mean? Like, are we able to help someone have quality of life? Is that in itself a good enough goal that meets medical necessity?
That's a very good question, Jamie, and I want to kind of hit on it. Medical necessity has not changed because medical necessity is state by state, right? Essentially, what we are trying to do is to help people understand medical necessity from a philosophical standpoint. So it's not just about a checklist of specific things. We want you to understand where medical necessity was derived from. And it came from that concept of psychiatric rehabilitation as a viable way of engaging people with substance use or mental illness and other challenges. How that really relates to what's best practices, what's the best quality of services. So medical necessity is still very concrete. You know, they have to have a diagnosis, they have to meet certain criteria, but we want you to understand more as to where it stemmed from in terms of philosophy and concept and principle. Does that answer your question? Bravo.
It does, but I'm disappointed.
Sorry. That's quite all right. And Seidel says to make sure it's clear the homework to engage with a client and what their value life roles are and bring info back to next week's session. Absolutely. That's spot on. All right. I want to certainly respect your time. I want to thank you all for your time today and to remind you that both the recording and a PDF of the presentation will be available to you soon. It will come through DBHR and it will go directly to your email that you register for with. And I look forward to seeing you next week. And I hope that you take this opportunity to kind of engage in discussion with your consumers around valued life role and bring back that feedback to next week. But have a great rest of the week, and we will see you next week. Take good care of yourself. Thank you, Crystal.
Thank you, Ryle.
All right, take care.